Hello everybody, welcome to Jeff the Pharmacist. It is an honor to have you here. So today we're talking about Invokana, and I just want to say I'm sorry I haven't been here in a little while. I was on vacation with my husband. We were in Taiwan and Japan and with his parents, so just hanging out with the in-laws. Everything was in Chinese, so I had a lot of time in here. So I want to thank you guys for tuning in. Today we're talking about Invokana. So I want to talk about how the drug's taken, some side effects with the drug, how the drug works. And I want to end the video with how effective it is. And in diabetes drugs we look at A1C. So Invokana is a drug that works specifically on your kidneys. So if you're on dialysis, that wouldn't be a drug for you. If you have poor kidney function, it wouldn't be a drug for you. It requires decent kidney function in order for the drug to work, and there's actually parameters on how much of the drug you would get based on kidney function. So some people who have mildly reduced kidney function could still take the drug. The drug is a little bit taxing on the kidneys, and there are some people who do have issues with kidney function on the drug. And that makes sense because it does work on the kidneys. The way it works is it inhibits something called sodium glucose cotransporter. So what that does is, if you think of the kidneys, it's like a big filter. So your heart pumps blood throughout your body, and it pumps blood through your kidneys. And your kidneys kind of filter all this crap down that comes out of your blood into urine. So it takes poison and stuff out of it. That's why people need the kidneys. If they don't have it, there'll be too much, their blood will become toxic. So what the sodium glucose cotransporter does is basically would keep glucose in your blood, because you kind of need glucose. It's something that is supposed to be kind of scarce in the environment. It's not in 2019 in America. What it does is it allows you to basically pee out glucose. So, you know, if your urine basically becomes Kool-Aid or lemonade, and that helps to reduce the amount of sugar in your blood because you're peeing it out. Another thing is it can also increase the volume that you're peeing out, and that can actually cause one of the side effects, which is hypovolemia or low blood volume. And low blood volume can translate into lower blood pressure, and lower blood pressure can cause people to get dizzy and fall. So that's one of the side effects, is falls, because if your blood pressure is lower, you stand up, you start to feel dizzy. And you know, even as a kid, this would happen to me, where I'd be sitting on the couch for like 9 hours, and then I'd get up real quick, and then I would start to almost like black out. So that's something that could happen with Invokana. Since it is a drug that works on the kidneys, it can impair some of your kidney function. In the package insert, they wrote about how people on the higher dose of Invokana had 4% of them had some event of major reduction in kidney function. I don't know if the kidney function resumed after they stopped the drug or what. If you look at placebo, it was 2%, because diabetes is already kind of taxing the drug. The disease itself is already taxing on the kidneys. So Invokana is taken, it's 100 milligram once a day before the first meal of the day, or 300 milligrams. And it's based on your eGFR rate, which is a measure of filtration in the kidneys. It's just basically kidney function test. So Invokana can cause hypoglycemia and more than placebo. So that makes sense with any drugs that reduce the amount of glucose in the blood. They can all cause hypoglycemia. And when you add them together, there's a higher chance of hypoglycemia. So overall, in the placebo group, there was 2.6% incidences of hypoglycemia. In the Invokana 100 milligram group, it was 3.6%. And in the 300 milligram group, it was 3%. And the chances of hypoglycemia increase by the more drugs you add and the type of drugs you add. So like a sulfonylurea is another kind of drug that increases the amount of insulin in the blood and can cause hypoglycemia. So if you add that to Invokana, your chances of getting hypoglycemia is even higher. In the 300 milligram Invokana group, it was 12%. So there is still a risk with hypoglycemia with Invokana. Some people experience cholesterol issues and bone fractures, hypotension. So some people do have lower blood volume with the drug, and that can cause lower blood pressure. And then hypotension can cause dizziness when you stand up, and can cause people that are more frail to fall over and break a bone or a hip or something else. So falls were an issue with the drug compared to placebo. Most of these diabetes drugs are contraindicated in ketoacidosis. And I think one of the more interesting and kind of crappy side effect is it can lead to UTIs, and this was not that uncommon. So if you look at this chart here, after the 26 weeks, female genital mycotic infections, the placebo group was 3%. In the 300 milligram Invokana group, it was 11%. UTI was higher, increased urination. That's part of that whole spectrum with hypotension. You're peeing more, your blood pressure goes down, and you can stand up, if you're sitting on the couch, eating bonbons or not, and you stand up and you feel a little dizzy and fall over. And one kind of interesting thing about UTI is that in older people, it can kind of look like a psychotic episode. So this was something I saw when I did rotation in a psychiatric hospital. Was we would always scream for UTI, especially in older women. They would come in and often present as, they might get diagnosed as having bipolar disorder or something, and then you clear up the UTI, and sometimes that would fix the mental state. Because if you think of a UTI, it causes kind of just a general discomfort, and you can see how maybe that would manifest as some kind of a psychotic break or something. All right, so lastly, does Invokana work? So basically, it is pretty effective. I think in the 300 milligram group, it reduced A1C over 26 weeks by 1 point of A1C, which is very good. In the 100 milligram group, it was 0.77, which is still very solid. And so I think it is an effective drug. Unfortunately, it's still very expensive. If you're a commercially insured patient, I think there is an Invokana copay card. So anytime you're a commercially insured patient, so that's somebody who has a job and gets insurance through that, think about just looking online for a copay card. And all of those cards would come from the manufacturer. So there are lots of different drug cards, like to help people pay for if they're paying cash. Like I have one, which I can link to, which helps people who have to pay cash, especially for certain generic drugs, which the retail price can be very high, but once you use like the discount card, it goes down a lot. Drugs like finasteride or generic Viagra, they have come down a lot, and I have my own drug card, which I will share with you. But copay cards are useful for people that, maybe you're on Invokana, but you have to pay $150. I haven't looked before this. I made this video, so I will look and see if there are any copay cards. Now, if you're on Medicare, you can't use it, so don't. I've been chewed out so many times for people who have these copay cards and they're on Medicare, but on Medicare it's against the law. We can't take them. It's called the anti-kickback law, and it's sometimes I do get yelled at over why can't you take my copay card. It's like, it's the federal law. It's like, just take it. So anyways, so just another plug. If you have type 2 diabetes, a great way to reduce your A1C is also to consider a ketogenic diet. That's a diet with 0 carbs. A 0 carb diet would reduce A1C dramatically, and some people even get off medicine entirely. Now, is that a cure? No, because if you went back to happy food, it would come back. Happy food being things in bags and that's prepackaged and has lots and lots of ingredients and sugar in it and corn syrup and whatnot. So I hope you all found this interesting. It has been an honor to have you here. I want to thank you guys for watching. Thanks a lot.